diabetes. So far, the patient's reported symptoms are flushed cheeks, fruity breath odor, feeling of dryness, abdominal pain, vomiting, and frequent urination. Now, what is the patient's diagnosis? Now we will focus mainly on the hormone molecule insulin. Insulin has a receptor in which a protein binds to. There are two copies of protein chains that form the glycoprotein receptor and is bounded by a disulfide bond to the insulin, in which the membrane of the two tyrosine kinases are connected. The glycoprotein receptor is actually in red right there. Insulin is also made up of polypeptide chain A and B and is held by a disulfide bond in the middle. Only when the insulin receptor binds to the insulin does the constraint release. Then the insulin receptor and insulin will then phosphorylate and activate. Once they activate, it can send the hormone signal to the body. If it doesn't bind, it will not activate and send a cellular response to the body. The diagnosis is diabetic ketoacidosis, a case study presented to you by Kathy, Kelly, and Rowie. Diabetic is a condition in when a person has high level of ketones in their bloodstream, making a blood pH very acidic. A normal blood pH is maintained at 7. So how does this happen? Glucose is the main source of energy. The insulin hormone is usually present to control glucose. However, when there is no insulin to control glucose, the glucose level rises. The body uses fat storage for energy that produces ketones. Ketones are created from the breakdown of fat. As a result, lots of ketones are in the bloodstream, which is harmful to the body. The causes of diabetic ketoacidosis are no insulin, lack of food, and high blood glucose levels. Diabetic ketoacidosis pertains more to type 1 diabetes. Therefore, the insulin molecule plays a huge role in this health condition. This is because type 1 diabetes can't make insulin. In type 1 diabetes, insulin can be destroyed by autoimmunity in the pancreatic cells, or the insulin is mutated and is not functioning due to receptor issues. If you know you're diabetic, here are some tests to test for ketones. They are blood electrolyte tests, urinalysis, chest x-ray, and electrocardiogram. The treatments for DKA are fluid replacement, insulin therapy, electrolyte replacement, and further treatments if there is added illness. Here is the diagnostic criteria ranging from mild DKA to hypersmolar hyperglycemic state. Notably, the acidity of blood, bicarbonate level, and the mental state the person in determines the severity of diabetic ketoacidosis. From the information of diabetic ketoacidosis, it is important to identify health issues and underlying causes medical researchers are trying to find, because about 1/3 of all people with diabetes do not know they have the disease, so do stay informed.